Everyone. Perfect. So thank you so much, everyone, for coming. It's great to have a good group together, and I hope that you find the information that I've got today to be helpful and useful. I'm hoping you'll come away from today with one or two things that you can implement straight away, and then hopefully some additional information that'll be helpful long-term as well. So I'm going to share my screen here. Oh, skipped right to the end and showed you the last stuff there. Okay, so now I'm going to start presenting. Okay, so today we're going to be talking about sitting-based work and spine pain prevention. So I am also doing a presentation next week on standing-based work. We've just decided to split it up because the approach is slightly different between the two. So a little bit about me. My name is Dr. Chandler Kutney. I graduated from the University of Ottawa in 2016 with my Bachelor of Science in Human Kinetics. From there, I went to CMCC and I graduated in June of 2020 with my Doctor of Chiropractic. I have experience treating under supervision in Toronto at the Sherbourne Health Centre and at the St. Michael's Hospital Family Care Unit. And then I've been treating here at Natural Soul Wellness Center as part of our multidisciplinary team since January. And a little bit about our clinic. So we are a multidisciplinary center and we've got a variety of different providers. The idea is that it's kind of a one-stop shop. So we've got a registered nurse, two massage therapists, we've got an acupuncturist, reflexologist, and laser therapy technician. She does everything. And then a licensed skincare esthetician and a certified Reiki practitioner. So let's chat a little bit about spine pain. So why do we actually get spine pain? One of the things that the evidence has shown us around spine pain is that there are many different aggravators, but actually the best indicator of having spine pain in the future is having had it in the past. So if you've had spine pain before, it's likely that you'll have it again. Some of the other things that can contribute are a change in activities. So if you're kind of a weekend warrior and you decide to start doing hour-long workouts out of the blue for the first time in a little while, especially with COVID, sometimes that can add to some increased stiffness and pain. Conversely, if you are typically a very active person and you go through a period where maybe you're sick, maybe work's really stressful and you're not able to be as active as you usually are, that can also increase your pain levels. Stress is another one that can increase pain, and we'll get into that a little bit more later. And fear about the pain, those two kind of go together, and we'll discuss that. I have an example down the road. Bed rest. So one of the things that we know about spine pain is that bed rest is not recommended for almost any form of spine pain. If you've had a surgery or a fracture or a dislocation, something like that, some level of bed rest may be beneficial in the very short term, but almost any other kind of spine pain, bed rest is not recommended and can actually increase the amount of time that you are, not operating as well as you'd like to. Prolonged postures. So this is a big one, especially with our sitting-based work. We're all kind of stuck sitting and at the computers, especially a lot through the day. And so that's a big one that plays a major role with sitting-based work. And then low levels of activity. So in general, we know people who are more active tend to have lower levels of pain and disability due to spine pain. And with all of our sitting-based work, it can be hard to get all of that activity in. So that's one of the things we'll talk about a bit as well. So here's an example, and this is to talk a bit about that fear and that stress and how it can impact our pain levels. So we've got two different people here. The first one is a student, and the second one is a professional skier. So let's say both of these people injured their thumb. Maybe they fell and landed funny on their hand and they have a bit of an injury to the thumb and things are a bit sore. For the student, especially nowadays where we're doing so much typing, that's probably not going to slow them down too much. They can still go to all their classes, they can do all of their lessons, they can do all of their studying. It's probably not going to impact them too badly. So they say, yeah, I'm sore, I'm stiff, but I'm still able to do all of my activities. It's not slowing me down at work. I'm able to do my studying and my grades haven't been impacted. Now, if you look at the professional skier, when professional skiers are using their poles, the gripping motion of that can be severely impacted by pain in the thumb. And so it might make it difficult for them to perform, whether they're doing racing or moguls or whatever it is. it might make it difficult for them to perform as well as possible. And if they can't perform as well as possible, they might not make it into their competitions. They might not be as competitive as they want to, and it could impact their finances. So there are a lot of different things that can be impacted by the injury for a professional skier as compared to the student. And these are things that can impact our pain as well. When we have an injury or a condition or a pain that impacts our quality of life to a more significant degree, whether it's your work or your hobbies or your home life, it actually increases the amount of pain and disability that you perceive as well. So our student over here will be like, oh yeah, I had a bit of a sore thumb, but it went away, it's all good. Whereas for our skier, it's going to be a much bigger deal, and that can actually impact the pain that you feel as well. So that's how that stress and that fear about the pain can really impact what you experience too. Some important things to know about spine pain. Over the course of a year, we can see that 30 to 50% of people will have neck pain, 15 to 35% of people will have mid-back pain, and 25 to 45% of adults will have low back pain. And then at some point in their lifetime, 80% of adults will experience neck pain, and 70 to 80% of adults will experience low back pain. So the big thing I want you to get from this is that spine pain is extremely, extremely, extremely common. Almost everyone will experience it at some point in their life, and it is something that tends to come and go with changes in activity and other things that happen. And then prevalence is very similar across the world. So one of the things that we hear a lot of the time is people saying, oh, it must be only because of my sitting-based work that I'm getting a lot of low back pain. And one of the things we can see is that across a lot of the studies, people who have different lifestyles actually report similar levels of pain and disability. So while sitting and being stuck in those postures and not being as active as you'd like to be might be a factor, it's not the only thing that impacts your spine pain. Another really important point is that most spine pain gets better on its own. So having spine pain and feeling like maybe you threw your back out or things are consistently sore is not an indication for a major injury or damage that requires invasive treatment or imaging. So things like surgery, injections, all of that kind of stuff is typically something that you want to try if you haven't had success with exercise, manual therapy, and some education around spine pain. And then again, if you've had spine pain in the past, you're more likely to have it again. So now I have another little example, and this is to start explaining a bit about how muscle spasms occur. So one of the things you might have noticed about going to the airport is that when you get off the plane, sometimes it feels like the location where your plane docked and the location where you're picking up your luggage are as far apart as possible. And it's like, who the heck designed this? This makes no sense. It's such a waste of time. But one of the interesting things is that was actually done on purpose. And the reason is when you're sitting in the plane for an extended period of time, you get what is described as creep happening through your ligaments, your muscles, and the soft tissues in the spine. And what that means is that all of those muscles and ligaments are kind of starting to stretch and relax as you're sitting. And what can happen is if you stand up very quickly after a period of sitting for an hour, maybe more, and then you go to do something that requires a lot of energy, so lifting a heavy bag or bending over to do something that your body's not used to, that can actually increase your chances of getting a muscle spasm. So, and that's typically when people say that they throw their back out, that muscle spasm is typically what's going on there. And so airports have actually been designed this way to try and decrease the likelihood of people getting muscle spasms when they're picking their luggage up from the luggage bay, which I thought was kind of a cool little thing. So if we talk about muscle spasms a bit more, muscle spasms are a protective mechanism. So when you've got that lengthening and stretching out of the muscles that happens, and then once those are kind of stretched out as much as they will, you end up more relying on your ligaments and other soft tissues to hold things in place like they typically would. And the problem is that those don't stretch to the same degree as the muscles. And so sometimes you can get teeny tiny little tears happening in the ligaments and the soft tissue. And when you get those teeny tiny little tears, it actually sends messages to the rest of the body saying there's a little bit of injury happening here. We don't want it to get worse. So we need to prevent this from happening. We need to protect it. And those muscle spasms are the seizing and protecting of those ligaments and soft tissues to try and prevent more injury from happening. You can kind of think about it like a rubber band. Those muscles are kind of like a rubber band where you stretch it out really far, and then it takes quite a while for it to go back to its normal shape if you've held it there for a while. The only problem is sometimes these muscle spasms are too protective. So the degree of injury that you've experienced with those tiny little tears in the ligaments is out of proportion with the amount of spasm that you're having, and your back's trying to protect you against something that's not too severe, and it can actually be worse than what your body's trying to protect you against. So that's all fine and good. Hopefully some of that's interesting, but I know everybody's most interested in what you can actually do about this. So we've got some points that we can move through. First of all, we want to move regularly to prevent the pain and stiffness from starting. So my general recommendation for people who tend to work with more sitting-based work is you want to move for about 5 minutes every hour. You might be able to get up after a meeting, maybe set yourself an alarm if you're doing more independent work, and you want to be doing something that incorporates a lot of movement. So simply standing up might not be quite enough for what you need. Some of the recommendations I make is try dancing to a full song, starting more gradually and then building up your movement. Take a walk around the block. Maybe you'll do some yoga, whatever you find is most beneficial. Different people enjoy different things, but we want to be getting some good movement through the body, and you want to focus on moving the areas that bother you the most. So if you're somebody who experiences a lot of low back pain, doing neck circles and stretching out your neck's probably not going to help you as much as doing some dancing, doing some yoga that targets the low back a bit more specifically. Next, strength training is proven to reduce the likelihood of having spine pain. So this kind of comes back to those low levels of activity we were talking about. People who have focus on strength training more regularly are less likely to have spine pain. So when you're working to prevent low back pain specifically, you want to strengthen muscles in your back, your core, and your pelvis. If you haven't done this kind of exercise before, I'd be happy to help you get started, give you some pointers on some general things that would be helpful for your situation, especially if you don't have any major health conditions. Strength and resistance training is beneficial at some level for almost everyone. When you're sitting, you want to change your sitting position every 30 minutes or so. So another one of those big things we hear is, oh, you have to have good posture. And you definitely want to have good posture, but what the evidence has shown is that good posture means varied posture. So sitting in one position for an hour or more at a time, even if you have what you think is the best posture possible, is going to cause you some soreness and stiffness because your body has to hold you in that position. And so the muscles that are responsible for that are going to get tight and sore. So actually switching your sitting position is the best way to change how your body is holding itself so that things don't get fatigued as easily. You're giving your body a break in different aspects while you're loading different positions. So you can try things like crossing and uncrossing your legs, lean back in your chair or sit up straight. You can sit cross-legged. You can turn to one side versus the other side. These are all different ways that you can sit. And depending on the kind of chair you have, you probably have even more ways to do it. I just have a stool, so it kind of restricts the way that I can sit. But sometimes I'll even sit with my arms and my chest resting on the table if I'm doing some reading and putting my back into a bit of extension, and that any kind of movement or change can be helpful. And so changing your sitting position is a really beneficial thing for that. So if you do experience pain, take a deep breath. Remember that spine pain is extremely common and likely to reoccur. So the fact that you have pain doesn't necessarily mean that you've done anything wrong, that you have bad posture or anything like that. It is something that's very common. Almost everybody experiences it. And the things that can increase our likelihood for having pain aren't just to do with the structural. A lot of it has to do with stress, fear, even things like nutrition and sleep. So it's a very multifactorial problem. And so there's a lot of different things that can impact it, which means that there's a lot of things that you can do to help with it as well, which is great. And then lastly, like we said, much of spine pain resolves on its own. So usually for a standard low back pain, it will resolve on its own within 4 to 6 weeks. So keep moving if you do have spine pain. Again, bed rest is not recommended for spine pain unless there's significant trauma. So again, something like a fracture, a dislocation, a surgery. You want to stay within your limits for pain. So some discomfort is okay, especially when you first start moving. You might have some stiffness, some soreness, sorry. And you want to start by moving gently and slowly. Lastly, you know your body best of anyone because you've been living in it for the longest of, I mean, nobody else has ever lived in your body. So you know your body best. And so you know what is an okay level of stiffness and pain and what might be a little bit too much. And if you're not too sure about that, talking with myself or with another healthcare practitioner can be a good way to get some guidance on that. You can also stretch tight areas and work on them. One of the things I like to recommend is that active stretching is better than passive stretching. So active stretching is moving in and out of the area kind of like this, whereas passive would be simply staying here for about, a minute or more. Sometimes with passive stretching, you can get that same creep happening that we were talking about before, where the muscles end up stretching out and then the ligaments get super stretched out too, and that can make you prone to spasm. So I find moving to your end range and then coming out of it, especially if you've had some spasms and you're trying to work things out, is a better way to address the pain. Movement is key, and some tenderness is okay. Again, my general rule of thumb is we want it to be 6 out of 10 of pain or less. So whatever that means for you, but you know your body best. So stay within a comfortable kind of normal level of stiffness compared to how you've been feeling. You can also use a ball or a foam roller to work on your own muscles. So sometimes I have patients who will stick like a tennis ball against the wall so that they can kind of roll it against their neck or their mid back. Or you can use a foam roller on the floor. Any of that is fine. If you have any questions about how to do that, please let me know and I'm happy to talk with you a bit more. And then lastly, you can see a chiropractor or another healthcare provider if you're having trouble. One of the big questions about this that I get is, when should you see a chiropractor? Should you see them straight away? Should you wait a little bit? What's the best way to go? And it depends on the person. So different people have different experiences. Some people know or have experienced that if they don't get help straight away, then things are going to linger. Some people are experiencing back pain and things tend to resolve fairly well on their own. So usually what I say is that if you feel like it's really debilitating, if you feel a lot of fear around doing some of your regular activities, or it's lasted more than about 4 weeks, those are good times to start talking to somebody about it, because we know that especially low back pain and full spine pain usually lasts for about 4 to 6 weeks total. So by that 4 weeks, you should start to be seeing things getting better. And if you're having a lot of fear and pain with trying to do your regular activities, then that can actually make it difficult to get back to them as soon as we'd like. And so we want to bring things down to make sure that they're as controlled as possible. So those are all times that I would recommend going to see somebody about addressing it. And then lastly, if you're consistently finding that you're having pain, so if it comes and it goes and it comes and it goes and you're not sure what to do about it, those are kind of the main times that I would say seeing somebody is a good idea. All right, so I'm going to shift the screen back to me so I can walk you through some movements. So feel free to turn on your screen if you'd like to. Otherwise, if you'd like to just follow around or follow along with me, I'll start with the neck, we'll move into the mid back, and then we'll move into the low back, because I feel like those are major areas we want to target. So I find with a lot of people, you'll get lots of pain and stiffness through the neck up here. And so some of the big stretches that you want to do for that area are the ear to shoulder. So again, I like to go back and forth. Usually I say doing this about 4 to 5 times in each direction is really helpful. So you can go both ways. The other one is you want to, there's another muscle back there that responds best to actually going down towards your armpit. So I put on nice deodorant this morning, hoping everybody else did too. You can stick your chin down towards that armpit. You're going to feel the stretch more in the back of the neck as opposed to the side of the neck. And you kind of come up and back and then down towards that armpit. Mine's actually feeling okay today. We'll see how the other one's feeling. Going that direction. Yeah, those ones are feeling okay. It was more the other one for me. So those are some good neck stretches. There are two more that I want to show you for the neck. So next is a strengthening exercise. So one of the things that we know about people who work at desks is sometimes we get stuck in this position. And so the neck kind of gets pinched back here, stretched out through here, and then you get some like rounding in the back. And so there's a neck exercise that you can do to try and change that. And what you want to do is you're going to give yourself a double chin. I can't believe I'm doing this on recording, but here we go. So what we're going to do is you don't want to go down like this. You want to go straight back like that. And so if you go here, you're going to hold for a few seconds. You should feel activation in the back of the neck, and it's going to help strengthen through the front. And that's going to help strengthen and work through the neck in those areas that tend to get shortened and tight in the back, and then lengthened and kind of weak in the front. That's kind of how we want to address those. And then lastly, for a nice little movement snack for the neck, one of the things you can do, you know, in your 5-minute break during the hour is just doing some nice big neck circles in both directions, as big as you're comfortable going. Sometimes you might get some crunchies in the neck. I get them too. It's totally fine as long as it is not uncomfortable for you. So all of those are some ideas for neck things. Next, I'll move into the mid back. So for the mid back, the major ways that we move through the mid back are with coming up and down, and then by twisting side to side. So those are the motions that we want to be moving through to give your body a break. So I like to do a seated cat camel when I'm trying to warm up things through the back, especially again, where we're coming into this rounded position a lot of the time. I like to emphasize the extension. So coming back, pulling your shoulders back, stretching out through the chest, lifting up the chin, and then you can kind of go into that flexion as well. Again, you might get some crunchies, some pops. That's totally fine as long as it's comfortable for you. And some strengthening for the back. You want to be pulling back with the shoulders as well. So if you do a strengthening routine right now, you want to be pulling back and working on that extension and then stretching through here, and that's generally helpful.
There's one comment in the chat saying, I've always been told you should not roll your neck back.
Okay, that is true for some people. It depends on if you've had trauma or you find that extension is aggravating, then you don't have to come all the way back when you're doing your circles. You can kind of just stay going up. It depends on the person. So some people find that it's fine. I really like moving through that range because I find it's helpful for me. But if that's a concern of yours, or you find that that's typically aggravating for you, then you definitely don't have to do that. Lastly, for the mid back, one of the things we like to do is add some of that rotation. So what you can do is, I'm going to bend this down so you can see a little bit better. You're going to take your arms, you're going to place one here, and you're going to reach through. And this one's called a thread the needle. So you come up with your arm back here and then through. And you'll get a nice stretch and a movement through that mid back. And you can do it on both sides. You can also do all of this lying down or on your hands and knees on the floor, but I know sometimes we don't have enough time to do that. So I'm trying to show it to you sitting, because then it's easier to incorporate into your day-to-day. Lastly, we're going to move into the low back. So for the low back, usually I like to do some of the movement exercises standing, just because I find that's an easier way to get at it. So I'm going to show you some of the standing exercises I like to do. First, I'm going to reach down towards the floor, come down. I like to shake everything out. You can kind of go side to side. If you find things are really stiff and sore for you, and you're prone to those spasms, you want to go slowly with that. You might not want to go the whole way down. Pay attention to how your body's feeling. You can also do some of these twists side to side here. And then I also like to do pelvic tilts. So if you press on your hip bones in the front here, and then kind of down into your lower hip, you're gonna move through some pelvis motions like this, and that'll help kind of work on moving through the pelvis. And then if you find that you're having a lot of low back pain, one of the things we know is that strengthening the core and the glutes can be really helpful for decreasing that pain. So I hope that that was helpful. I'm going to go back to my PowerPoint now. And so how can I help you? So usually with people who are experiencing spine pain, we'll do some manual therapy. So things like work on some of the tight and sore muscles. We might do some adjustments through the joints. We might do some mobilizations catered to what you need. A big component of it will be the exercise, movement advice, stretches, and strengthening. We've kind of touched on some of that already today. And then we'll talk a bit more about education on spine pain, expectations, preventative strategies, and then pain management tools if it does come back up. My big focus is bringing down the pain that you're experiencing and then decreasing the likelihood of it coming back, because we know it is something that tends to recur. And so here are my references. If you're interested in any of them, please let me know. And I think I can see a question here. So Kim asks, do lower back stretches help with tailbone pain? They definitely can. So especially that pelvic tilt one can be helpful for pelvic or for tailbone pain. It would depend on the cause of the tailbone pain. There would probably be other things I'd want my patient to be doing if they were dealing with that too. But starting with some of those low back stretches and especially that pelvic tilting is definitely a good place to start off with. Okay, so that's the end of my presentation. I'd love